Hi everyone, in this video I will talk about specialty places you can choose to work in as a nurse practitioner in 2021. In this channel, I aim to provide more information about the nursing profession and share my nursing knowledge to help others. If that interests you, please consider subscribing and giving this video a thumbs up. I would greatly appreciate that. Nurse practitioners are one of the fastest growing advanced education degrees you can get post-nursing bachelor's. That is because you gain a provider role allowing you to help and treat others in a more autonomous way. This is great and excites me as this is not only an area that interests me, but it also allows for better care to be achieved for patients in the hospital or community. Alright, so let's talk about specialties you can choose from as a nurse practitioner. This video will mostly talk about NPs in Canada and US, and there are some significant differences between them. Let's talk about the US trained NP first. So USA NPs. The Masters of Science in Nursing Family Nurse Practitioner program prepares experienced professional nurses for advanced practice as primary care providers. The Family Nurse Practitioner program makes independent critical judgments in all levels of prevention, including health promotion, illness prevention, and diagnosis and management for individuals and families, communities, and populations. The FNP performs comprehensive health assessments, diagnoses illnesses, and prescribe pharmacological and non-pharmacological treatments to manage acute and chronic health problems to achieve quality, cost-effective outcomes in culturally sensitive contexts. The role of an FNP includes educating, consulting, collaborating, using research to make practice decisions, and influencing professionals and public policies within various practice settings. The FNP provides healthcare for clients across the lifespan. Masters of Science in Nursing Acute Care Nurse Practitioner with an emphasis in adult gerontology. So this program enables experienced nurses to provide advanced level of care in complex, acute, and critical settings for adults and geriatric populations. In the acute care role, nurse practitioner's scope of work includes providing assessment, diagnosis, and care for adults and the elderly. They perform health assessments, prescribe medication, and suggest quality health treatments to manage acute, subacute, complex patients, as well as those with chronic illnesses. Master of Science in Nursing Psychiatric Nurse Practitioner. Psychiatric mental health nurse practitioners are responsible for assessing mental health statuses of patients by studying their relevant medical history, performing comprehensive psychiatric evaluations, and identifying risk factors that might affect the patient's mental health. They make diagnoses of their patient's mental illnesses based on their assessment and then determine what will be the most effective plan of care by utilizing their knowledge, psychotherapy modalities, and psychopharmacology. And in collaboration with doctors and other professionals, these advanced practice nurses put their patients on a regimen of therapy and prescription medication to improve their mental health. So now let's talk about pediatric nurse practitioner. The primary care pediatric nurse practitioner is to provide care from children from birth through young adult with an in-depth knowledge and experience in pediatric primary health care, including child care and prevention management of common pediatric acute illnesses and chronic conditions. Now, there are sub-specialties within NP. However, these are typically more FNPs that choose to work in a specific field. For example, there are posts in surgical NP which focus on that specific demographic for their work, or another great example is cardiac nurse practitioners. These NPs typically are FNPs who choose to work in those specific fields, typically learning on the job or sometimes doing further education. The US also allows DNP, which is a doctorate in nurse practitioner. The last I researched, I could not find one in Canada. Canadian NPs. NPs in Canada do not specialize in anything in particular, meaning that they do not do a specialty in a certain demographic from nurse practitioning school training. Instead, NPs work in a variety of healthcare settings, such as community care, which include community clinics, healthcare centers, physician offices, and patient homes. They also work in long-term care, so like nursing homes, work in hospital outpatient clinics, emergency room, and other patient areas, and they work in NP-led clinics. They typically learn on the job and are trained to work in a variety of different settings. So those are the differences, and those are different specialties within NPs. I hope you enjoyed this video. If you did, once again, I would greatly appreciate it if you give it a thumbs up and let me know what your thoughts are in the comments down below. And we'll catch you in the next video. Thanks for watching.